Hi, I am Pam Dunwald, and this is Linda Criticus, and we are your nurse advocates. Our company, Your Nurse Advocates Consulting, we are here for you when those unexpected health challenges arise and you find yourself in a crisis, either with you or your loved one. We're there to help you put a plan in place that's rock solid and to take you through those challenging times with those healthcare issues. Tonight, we're going to talk a little bit about October is National Dental Month. So we're going to go ahead and talk a little bit about some of the serious health challenges that can occur with with bad dental hygiene. So Linda, welcome.
Hello.
The first one we're going to talk about is diabetes. And this can be kind of a two-way thing. Gum disease, which carries the bacteria and the gingivitis, the gum disease, is very, very high in sugar. So this can exacerbate or make worse someone who already has diabetes that has poor oral care, poor oral health, or it can actually take someone that is on that borderline of being a type 2 diabetic and actually push them over the edge because of the high sugar. So, dental hygiene is something that, we think about brushing our teeth and, using mouthwash, but we really never, and we think about, okay, yeah, I might lose a tooth. I'm going to get a cavity. Yeah, maybe I have some gum disease, but most people don't realize, especially as people get older in age, they're more susceptible. Elderly people, their immune system is not as good, is not as strong. So some of these simple, what we would think non-urgent type of issues with oral care can really lead to some serious conditions. Linda, was there anything you wanted to say about the diabetes?
Now, it's really important that if you are diabetic, that you let your, that you talk to your dentist about preventative measures to make sure that they are looking at you as a diabetic or your loved one, so that as they do their oral exams, they can make sure that they're checking your gums and your teeth for those early signs. One of the things that's really important, whether, if you find yourself in this situation, is to make sure that you're seeing your dentist every 6 months for cleaning and for a checkup to make sure that there is no exacerbation of your gum disease. Flossing is also really important. We think about brushing our teeth, we think about using, mouthwash or rinses in our mouth, but flossing is also very important. And for those of you like me who are not real coordinated with the little floss string, they have toothbrushes now that actually will brush your teeth and floss your teeth all at the same time, because they have pulsation on them that works really well to help get all that plaque out of between your teeth and around your gum line, which causes that gum disease, which more diabetics are more prevalent to get.
And the next one can be a very serious complication, and that is it can cause some heart-related diseases or illnesses. What I didn't really realize in doing, a little bit of preparation for tonight, that actually all that plaque and that bacteria actually can get into your bloodstream, and it actually adds to the plaque and the hardening of your arteries, and which we all know what that can lead to, your heart attacks, your strokes, and things like that. But other things that the bacteria in your mouth, if it gets into your bloodstream and it gets into your heart, two serious infections can occur. One, pericarditis, which is infection of the lining that surrounds your heart, or endocarditis, which could be fatal. And that's where the infection actually gets in your heart. And those could be two very serious things. You're hospitalized. You might even spend some time in intensive care, depending on how ill you get. And just thinking of something simple as just, trying to remember just to get in the habit of some good oral hygiene. Linda, was there anything you want to say about cardiovascular health or cardiac?
Yeah, this was something that really didn't come into being until probably, I want to say about 10 years ago. They really started correlating heart disease and gum disease together because of that plaque buildup in the bacteria. And one of the things that, if you find yourself in a situation or your loved one where they're having poor oral hygiene, or they're stating to you, I'm not hungry, or I'm just not, I'm just not feeling good, it could be related to poor dental care, especially if there are signs of dementia. So if you find yourself in a situation where you have someone who has dementia, a lot of times oral care they can be resistant to oral care. So you may want to think about making sure that you're checking or monitoring how they're doing their oral care, because it's really important, because it can lead to other comorbidities such as heart disease, along with maybe a primary diagnosis of dementia.
And, we've had cases, I mean, just recently, like, like this in the hospital. And another thing that, a lot of surgeons now, not oral surgeons, we're talking about general surgeons, orthopedic surgeons, a lot of surgeons, when you get your pre-op, a physical before you're having, say, an elective or routine surgery, sometimes the providers, if they notice that your oral hygiene is poor, that your oral health is poor, they won't do the surgery until after you've gone to the dentist and have been cleared of any, periodontic disease or any, infections in your mouth, and they may postpone your surgery. So that's another good reason to make sure that you're getting in the habit of good oral care. The third one we wanted to talk about is respiratory infections. So think about it. Your mouth is the first line, your mouth and your nose are the first lines of defense when it comes to fighting off bacteria and viruses and things that get into your system. So if you have poor oral health, you are now in your gum disease, you are now have bacteria in your mouth all the time. If this gets down into your lungs, it could cause a serious lung infection, especially for someone who maybe is already compromised with lung conditions such as asthma or COPD, emphysema. So that could predispose you possibly to a serious lung infection with that. Linda, is there anything you want to mention about that?
Yeah, when you have gum disease, your immune system goes into overdrive, trying to continually fight off the bacteria and the inflammation. So having that bacteria travel throughout your bloodstream or into your lungs just wreaks havoc on your immune system and makes it harder for your body to fight any secondary infection that you may end up with due to the primary diagnosis of having gum disease. And that's why surgeons are so reluctant, as Pam said earlier, to do surgery on someone who may have some type of gum disease or some type of poor dental health, because it just increases the risk for postoperative complications to the lungs. And also, depending on whether you are intubated or not, to possibly even losing a tooth or causing more damage to your gums that are already there because they're so inflamed from the gum disease. And what's interesting about gum disease is that initially gum disease is kind of a silent kind of disease process. A lot of people don't even realize they have gum disease until they actually go to the dentist, and the dentist starts poking around with those little lovely tools that they have, which I cannot stand, but it's a necessity. And your gums start bleeding. Gum bleeding or bleeding gums is a true indication of gum disease. So if you're brushing your teeth at home and your gums are bleeding, you pretty much have gum disease and better be checking that out with a dentist. Now, just a caveat to that is if you are on blood thinners such as Coumadin or Eliquis or any of those, that can also increase that bleeding to your gums. And that just is one sign saying that you may be on too much of those medications, and you may need to equate the dose so that you don't have any bleeding. But overall, one of the biggest and earliest signs of gum disease is bleeding gums when you're brushing your teeth. And they'll say, oh, I brushed too hard. I brushed too hard. It's just because I brushed hard. Then change your toothbrush, get a softer bristled brush. But I guarantee you, you're still going to have the gum bleeding if you've got gum disease. So the best cure for that is to go see the dentist.
And, and that's a good point. And I hear a lot of times, sometimes people, they either don't have dental insurance or they're worried about the cost of the dentist. And, that's one reason to reach out to Linda and I as your nurse advocates. We can help, find a dentist that, either private pay, or there are dentists that take Medicaid. So if you're on a state Medicaid, insurance, Badger Care, or an insurance Medicaid program. There are dentists that will accept Medicaid as payment, so it will not cost you out of your pocket to go to the dentist. So, these are the kind of things that we can help you with so that, you're not going without this care. So please don't, have the excuse that I can't afford it. There's ways around that, and we can help you with that as well. So the last thing that we wanted to talk about, and this is more up Linda's alley than it is mine, but there is a risk for women that are pregnant. If they have poor oral hygiene, they also are in increased risk of infections, increased risk of premature birth, and low birth weight for their newborn baby. So I'm going to let Linda talk a little bit about that.
Yeah, before I get into that, I just want to make a comment about Pam's last statement in regards to finding a dentist. If you are of Medicare age, a lot of the newer Medicare Advantage plans do have dental coverage, and based on your financial circumstances, that dental coverage could come to you free of charge. But that's where Pam and I can come in to help you, is because we understand those programs really well and can kind of help you make those decisions in regards to meeting your needs. So, and right now it is beginning open enrollment for those plans and for the overall Medicare program. So you need to just know that we're here to help you. But in regards to pregnant women, when we are pregnant, our bodies go through a lot of changes. They go through a lot of hormonal changes, a lot of emotional changes, and a lot of physiological changes. This wreaks havoc on our immune system, because our immune system is not only trying to protect us and take care of us, it's now trying to take care of this new life that is growing inside of us. So our immune systems are in overdrive all the time, because it's trying to take care of us in a way so that we can carry this child to full term and then deliver a healthy baby. When we have poor oral or dental health, that adds to the stress that's already placed on our immune system by being pregnant. So one of the most important things that you could do if you are pregnant is to actually make sure that you are seeing your dentist every 6 months and getting good oral checkups to make sure that that stressor of possibly having gum disease or having cavities, and a lot of those changes will occur during pregnancy just because of stress. So you may end up with bleeding gums. You may end up with more cavities. You may end up with a lot of different changes to your oral health just because of the hormones and the overall stressors it puts on our body, because of the pregnancy. So always make sure that you're going to your dentist every 6 months to get a good checkup during your pregnancy, to make sure that stressor is taken away, because you've already got enough stress on your body and on your immune system related to your pregnancy, because we all want to stay healthy. We want to have healthy children. So you need to make sure that oral health and good oral hygiene is part of that prenatal program.
And, if you have any questions about anything that we talked about, please put the question in the chat. We'll get them answered for you. And just know, if you or your family or a loved one or an aging parent, grandparent, they're in the middle of a health crisis and you don't know what to do, you feel like your backup is against the wall, that's the time to give us a call. We're a phone call away. Reach out, send us a message. We'll get a hold of you, and we'll help you get things straightened out. So with that being said, I'm going to say good night. And Linda?
Good night.
All right. We'll see you next week. All right.
All right. Bye-bye.